Hi everyone, my name is Bona Colaco. I am a licensed clinical psychologist in India, and I am one of the therapists at the Hyderabad Academy of Psychology. I am a new mom as well to a beautiful 9-month-old baby girl. And so I'm making this video in the middle of all of that, taking care of my child, trying to finish work. And just like pregnancy brain, I have a mom brain, which has to manage a lot of things, think about a lot of things at the same time. And it will show in the video because I look different and now versus when you look at the video, there are different parts that have been recorded at different times because of managing my schedule, doing whatever I can in the given time I have. And as you will see in the video, there is a place where you can see my slide notes. And I decided to keep it that way because it's important that I tell you, and we have this out there, that it's okay to do the best that you can as a new mom. And there's no perfect way of doing anything. There's nothing like, perfect. There's a quote that says, a perfect mother is a good enough mother. As long as you're in tune with what your needs are, what you are feeling in the moment, and how your baby feels and how your baby is doing, that's most important. And yes, doing the best that you can in the given circumstance is what is most beneficial to everyone. And so I hope you enjoy the video and you take care of yourself. Thank you. Hi, my name is Bona Colaco and I'm one of the therapists at Hyderabad Academy of Psychology. And today I will be talking about maternal mental health. One of the reasons I have decided to talk about this topic is because I am a new mom to a beautiful 9-month-old baby girl. And so I have recently experienced the joys and challenges of pregnancy. And I'd like to share what helped me and, what are some of the things that women find helpful during pregnancy and soon after childbirth in terms of their well-being, being physically and mentally okay. And so, about 10 to 35% of the women around the world, including India, suffer from depression during pregnancy and postpartum. And new mothers are at an elevated risk of suffering from mental health problems. Given all the changes that happen during pregnancy, there is a little tiny human being growing inside. And to support that beautiful life, there are a lot of changes that happen in terms of the hormones, in terms of the body changing to support the baby inside. And so it is an exciting time, but it is also very difficult, and that needs to be acknowledged. And a lot of times the emotional aspect of it is not given as much attention, and it is important to name the things that are challenging. I'm sure you must have heard the phrase, name it to tame it. And so as joyful and happy as the time is, there are also things that are difficult. There are emotions that go up and down. There is anxiety, there is a little bit of apprehension, sadness because of all the changes that are happening, and the brain is kind of dealing with all of these changes. And so different emotions come up. So it's important to name them. It's important to be aware of what's going on. And there is research along a lot of aspects, specifically biological and psychosocial factors. I will not be stressing a lot on the biological factors because a lot of research has gone into it and we have a lot of information available. What is most often overlooked is the psychosocial factors, or the systemic things that happen that play a role in mothers feeling either sad, depressed, postpartum, or during pregnancy as well. Among the psychosocial factors, some of the strongest predictors are severe life events like loss of a loved one or chronic stress, some form of other chronic strain, relationship quality, support from family members. These things play a very significant role in how a woman who's pregnant or a new mom or a mother who's just given birth, how they deal with all those changes. And so what kind of support is really important? What kind of support helps a woman go through this period and be okay, go through it well in a healthy manner? A lot of times in our current setting or in our society, a lot of advice is given around you should eat this, you shouldn't eat that, and it literally changes from place to place. And our country has such different subcultures, and so what is okay in one part of the country, that might be something that you asked not to do at all in another part of the country. So there's a lot of advice coming from everywhere. And so one of the things that I would really recommend is to hold off on advice that is not asked. Like, I know it may come from a place of concern. However, it's really important what the person who's pregnant, what they need, right? So in my experience, I was able to tell my best friends and people who are very close to me what I need. Like, I could say, hey, I'm going to ask you when I need advice. I'm going to ask you before I go for a scan, what do I need to do to prepare for it? And so I had my cousin, my best friend, telling me, be ready to have long wait periods, have your food and water ready, and things like that. And one of the best advice that my cousin gave me was, every scan you might be scared with something that shows up, but know that things get resolved over the span of your pregnancy. So the best thing is to stay as calm as possible, and I try to do that, right? I guess one of the plus side of being a psychologist is you have psychologist friends who give you the best kind of support. Avoid guessing the baby's gender based on the symptoms, or oh, the belly is higher up, it must be a girl or a boy. The belly is slightly low, so it must be. It doesn't really help. And so this is something that I'm sharing from my experience. I was again able to tell my closest friends. Of course, you cannot, it's difficult, it's seen as being impolite or rude. But if you tell people, please don't do that. But people who are closest to you, you can express, you can say, hey, this does not help me. It does not help if you try to guess my baby's gender based on what my symptoms are, what I'm eating, what my cravings are. So please don't do that. And I was lucky enough that my friends really supported me in that. One of the important things after birth, it's such a sensitive time, irrespective of whether the woman or the mom has had a natural, a normal delivery or cesarean. It in any ways, either cases is a very stressful time. It's equally painful. And so it's really important to offer as much support. Hold off on commenting about, oh, why wasn't it normal? Why was it C? Or, good thing that it is normal. Whatever was best for the mom and the doctor decides, and whatever is safest for the baby, that is what is done. And that discussion of which is better, normal delivery or C-section, does not help once the baby is there, once the baby is born. So at that point, what is really important is to support the mother, right? And a lot of times it's easy to, rush to take care of the baby, hold the baby, because the baby is wonderful. Babies are beautiful. You want to take care of them. However, it is really important to keep in mind that the mother's well-being is of utmost importance at this time. And because what is the best for the baby is also to have a good bond with the mother. mothers and babies, newborns, regulate each other's nervous systems, right? So it is important that you help the mom stay calm, be well taken care of, and only then can the mom, you know, spend time with the baby, help her, soothe her, feed her, right? It's easy to, you know, take on the responsibility of, oh, I'm going to take care of the baby. You rest. No, the best thing is actually to ask the mom, what would you want? How would you want me to support you, right? Allow the mother to speak about what would help them. And so if you're a partner, if you're related to a new mother or a mother who's just given birth, encourage members in the family or elders who take care of the mother and the baby to support the mother, right? To check with the mother how they want to be taken care of, instead of rushing to you know, take care of the baby because they might have had experience with taking care of babies, or they might know certain things about how to give bath or how to you know, wrap the baby. What is really important at this time is for the mother to feel supported so that she can take care of the child, right? And if the mother says that she wants time, she wants help with holding the baby, or she wants time to rest, then listen to that, right? And so with all good intentions, it's really important to check what is best or what the mother needs. Also, you know, all pregnancies are different. And so the birthing experience, the symptoms that are present during pregnancies, all of that is different. And there are no rights or wrongs, and each experience is unique. And so when people or any women in your life want to share those experiences, remember, when you're talking to a woman who's pregnant, it could be for the first time or the second time, my recommendation is to keep in mind the intention why you're sharing your story, if you feel compelled to share. Is it because, oh, you know, I've been through worse, this is nothing? Are you trying to, you know, make sense of what's happened to you, and in context of the current experience, you're trying to feel better about yourself? Is that it? Or the intention is, hey, we're in this together. I had a similar experience and this is what helped. So it is easy to, you know, because of all the judgment that women everywhere face, we sometimes compare. So it is best not to compare. Your experience is yours. If it was difficult, it's a very, you know, it's a struggle. And if it was an easy one, then great, good for you. However, whatever, you know, a new mom or a woman who's pregnant is going through is theirs. So it's best not to compare. Again, if you need to share something, ask the mother who's pregnant or who's given birth if they would like to hear what helped you. Right. So how can you support new moms in your life? If you're a partner, again, if you're a family member who's seeing this video, or if you are a new mom who's looking at it, how can you, you know, take care of yourself? Or how can you take care of new moms and pregnant women in your life? So what is not helpful versus what is helpful, right? Commenting or inquiring about baby's weight. Is there a reason why you're asking this question? Do you feel like you have the answer, or you can suggest certain things to improve baby's weight? Then again, hang on, ask if that's something that the new mom wants to know, because it's not very great to be checking about the baby's weight or commenting about whether it's low or it's high. It's a stressful period. The new mom might already be anxious about the baby's weight, or, you know, whether, you know, depending on how the experience is. Some new mothers or some women who've just given birth, they are able to feed the baby or breastfeed very easily. Some have challenges, and some are not able to breastfeed the babies. There is no right or wrong. There is no no such thing as normal. This is normal or that is, not normal. It's unique to each woman and their own bodies, right? It is nothing wrong if a lot of women have slight challenges during those times while breastfeeding. Certain women don't. So it just differs because our individual bodies are different, and so our experiences are also different. And so inquiring about mother's milk or suggesting formula are big no-nos, right? And also minimizing a mother's, new mom's experience, or a mother who's just given birth. It's not very helpful in terms of, yes, a lot of women have given birth, and a lot of times you hear, yeah, we've also gone through this experience, we've given birth to 2 children or 3 children, we know how it is. May not be true. Experience differ based on a lot of issues: the support you receive, the relationships that you have, the resources, the privilege you've had. And so, what you found helpful may not be something that another woman finds helpful. And so, that is important to remember. And it is not helpful to remind a new mom how difficult things used to be and how easy they have it right now. And it's never helpful to compare traumas. It was so difficult for certain women and you have had it easy. This is nothing. Those kind of comparisons need to be really avoided. And what really helps is, the best thing is ask. How can I, or how can we help? What do you need, right? The best thing is also to ask, how are you feeling? Is there anything you need help with? Or instead of just offering advice, asking, do you have any questions or concerns around childcare? Is there anything that I can share with you that will help you? Or just, I'm here if you need to talk. Those would be most helpful. Postpartum depression rates are low and symptom onset is delayed in cultures that emphasize family support to the mother over the first month postpartum. This is really important because a lot of cultures have this, right? A lot of us, have this specific thing of not just the baby, but the mothers are given certain massages with herbs and made sure that the mom is taken care of. And that research itself has shown that that is way more helpful, especially because postpartum depression is such a reality, and it needs to be given, the attention. If new moms are feeling low and are not able to, take care of themselves, then it's going to be difficult for them to take care of the child as well if they have severe symptoms of postpartum depression. And in that situation, again, instead of just taking over the care of the child, it's best to support the mother and provide whatever resources that they need, be it a consultation with the doctor, talking about their symptoms, helping them take care of themselves well. That needs to be done. Now, in the current scenario of how COVID has played a role, of course, now things are much better. However, my experience was very different. I, gave birth to my baby right in the middle of one of the peaks, and it was a very stressful period. And so, even research has, the current research shows that uncertainty surrounding the COVID-19, the waves and all of that have led to higher levels of depression among women during pregnancy, during and after pregnancy. And, pregnant women may feel social isolation, have greater fear of infection for themselves and their infants. And also, some women may not be able to access, the facilities, health facilities, when they really need it. And so that does lead to a lot of distress and also depression. Also, there's not much evidence around the risk of transmission or infection of COVID from mother to child, or and that also leads to stress and depression among pregnant women. Even though the research may be, coming in now, it takes time for it to reach women who might need that information to feel better or to feel safe and calm. And so in this situation now, because I, gave birth to my baby during that time, and I contracted COVID myself in the initial months, it was a tough time. And so even now I have some of those anxieties. And so it really helps when I receive support from my family and friends who understand when I say I don't want to socialize, or I do not want to go to places that are crowded even now. And so it's really important, to give mothers the freedom to make the decisions about their and their child's well-being. If they want to go out, if that makes them feel better, they need to have that freedom. If they feel they do not want to go out to places that are crowded, or in general, it's their decision, and it's important to respect that. Because I know that, I have also received some amount of judgment and criticism around why you're still not going out. It's safe now, you should go out. I know what I went through during those initial months, and it was quite traumatic to, that fear of what if you pass on something to your child, and staying away from the child is so painful. Staying away from your baby is extremely painful in the first few months, when you've waited, when you've, looked forward to having your child, not being able to hold your child. It is one of the most painful experiences, at least for me it was. And so the memory of those times and all the precautions that you take, and you still get COVID in spite of all of that, it leaves quite an impact. And so if the mother wants to still be careful, wants to take all precautions, it's best to just let them do that and avoid judging and criticizing them for that. And finally, what can you do? This is to mothers. If you're pregnant, or you're a new mom, this is not advice. This is, what has helped a lot of people. And again, do what suits you the best. There are no rights or wrong. Listen to the doctor. Listen to people who you trust. Accept advice that you feel is good for you. You are the best judge of what's, what works for you, what keeps you healthy, what keeps you calm, and what keeps you safe. So during times that are stressful, or even in general, the best thing is to focus on things that you can control. Things that you can't control are, how COVID waves come and go, what new variants are, coming up. That is completely not in your control. What is in your control is to wear your mask, follow all safety protocols, sleep well, eat healthy, move, walk, do whatever exercise you feel is good for you, and whatever your doctor recommends. Limit news and social media, because as much as they might be helpful, they also cause anxiety if you do not control or limit your exposure to them. Consult your doctor regularly. If you experience any sort of changes in your mood or emotions, and you feel that it's quite overwhelming, do share with your doctor and your gynecologist. They will recommend certain things. Speak to people, speak to trusted people, friends, and family members. And most importantly, it really does help to speak to a trained therapist. And so you can reach out to us at the Hyderabad Academy of Psychology. You will have the information below this video. And so I really hope this information was helpful to you. And do reach out if you need to talk, if you need help and counseling. We are there to support you during this, like I said, joyful, exciting, as well as challenging time. Thank you very much.